Today we're diving into something small in origin, but big in impact. It's heart infections. These are conditions where tiny organisms like bacteria or fungi invades the heart, especially the inner lining or the valves, and start causing a serious trouble. One of the most important types is infective endocarditis, where these germs enter the bloodstreams and settle into the heart, sometimes from something as simple as a skin wound or a dental infection. What makes it tricky is that it can start quietly, just fever, tiredness, maybe a subtle heart murmur, but it can quickly become a life-threatening problem if it's not detected early. So let's explore how these infections happen, who's at risk, and why protecting the heart is so important. So let's get into it.
Hello everyone, so today I'll be explaining the definition and the pathogenesis of rheumatic heart disease, also known as RHD. Alright, so rheumatic heart disease is a chronic heart condition caused by permanent damage to the heart valves following rheumatic fever. So rheumatic fever usually develops after an untreated or poorly treated throat infection caused by group A beta hemolytic streptococcus bacteria. So, in RHD, the body's immune system mistakenly attacks the heart tissues, especially the heart valves. So, this causes inflammation and eventually leads to scarring and deformity of the valves. So, the mitral valve is actually the most commonly affected valve. Now, let's move on to the pathogenesis of rheumatic heart disease. So, here is a step-by-step of how the disease develops. So, the process begins when a person is infected with a streptococcal throat infection. So when the bacteria enters the body, the immune system produces antibodies to fight the infection. However, some proteins on the bacteria are very similar to the proteins found in human heart tissue. So because of this similarity, the antibodies become confused and accidentally attack the body's own tissues. So this process is known as molecular mimicry. As a result, the patient develops acute rheumatic fever, which is an autoimmune inflammatory disease. So the inflammation can affect different parts of the body, such as the joints, the skin, the brain, and especially the heart. So when the heart is affected, inflammation occurs mainly at the heart valves. This is also known as valvulitis. The valve leaflets or cusps become swollen and inflamed. Now, if the inflammation keeps happening or is severe, healing occurs with fibrosis and scarring. So this then over time, the valve becomes thickened, stiff, and deformed. Eventually, the damaged valve cannot function properly. So this results to the valve becoming stenotic, meaning it is narrowed and difficult to open, or it can become regurgitant, meaning it leaks the blood backward. So this permanent valve damage is what we call rheumatic heart disease. So basically, the flow of the disease begins with a strep throat and it activates the immune response. The immune response begins to attack the bacteria. However, it also is confused with the proteins in the heart tissue known as molecular mimicry. This causes inflammation. The inflammation causes rheumatic fever. Rheumatic fever causes the valve to become inflamed, and during the healing process, it causes the valve to heal in a way it forms fibrosis and scarring. So this then inhibits the normal function of the valves, causing the rheumatic heart disease. Now, I'll be passing to my friend in order to explain the clinical manifestation of rheumatic heart disease.
Assalamualaikum and good day everyone. Today I would like to present about the clinical manifestation and investigation of rheumatic heart disease, or we call it RHD. Rheumatic heart disease is a condition where the heart valve becomes damaged after rheumatic fever. It usually happens when a throat infection caused by group A streptococcus bacteria is not treated properly. Now I will explain the clinical manifestation of rheumatic heart disease. Okay, the first symptoms is shortness of breath. This happens because the damaged heart valve affect normal blood flow and make it harder for the heart to pump blood properly. Next is fatigue and weakness. Patients often feel tired easily because the body does not receive enough oxygen-rich blood. And then patient may also experience chest pain or discomfort due to stress on the heart. Another clinical manifestation and common symptoms is palpitation, which means fast or irregular heartbeat, or also known as arrhythmia. Heart normal may also be heard during physical examination. This happens because blood flows abnormally through the damaged valve. Some patients may develop swelling at the legs or ankle due to fluid retention, and this also causes as edema. In severe case, patient may have cough or cough with blood because of fluid build-up in the lungs. Fever and joint pain can also occur, especially during rheumatic fever episode. Now, I will continue with the investigation for rheumatic heart disease. The main investigation is echocardiography, or ECHO. It uses ultrasound to examine the heart valve and check for valve damage. Next is ECG, or electrocardiogram, which is used to detect abnormal heart reading. Chest X-ray can identify enlarged heart size or fluid in the lung, and blood tests such as ESR, CRP, and ASO later are done to detect inflammation and recent streptococcal infection. Throat swab culture may also be performed to identify the bacteria causing the infection. In severe case, cardiac catheterization is used to assess the severity of heart valve damage before surgery. So in conclusion, rheumatic heart disease is a serious condition that can affect heart function if left untreated. Early diagnosis and proper treatment are important to prevent complications. So that's all from me. Thank you.
Okay, I will talk about infective endocarditis. First, we will go through the definition, which is infective endocarditis is a bacterial or microbial infection that colonize and multiply on the endocardial surface and damaging the heart tissue. Infective endocarditis is dividing into two groups, which is acute infective endocarditis and subacute infective endocarditis. For the acute infective endocarditis, it is a rapid progressive infection that caused by the highly virulent microorganisms such as Staphylococcus aureus. While for the subacute infective endocarditis, it is a slow progressive infection that caused by low virulent microorganisms such as Viridian streptococci, and also it comes with pathological condition like previously damage of the heart valve due to the rheumatic heart disease or congenital defect. Next, moving on to the pathophysiology of infective endocarditis. The pathophysiology is divided into the types of the infective endocarditis. So first, the pathophysiology of acute infective endocarditis, starting with the bacteria enter the bloodstream through the several routes of infection, like using the infected IV catheter and others. So the bacteria will travel in the blood circulation and goes to the heart, specifically at the endocardium or heart valve. So it will lead to the bacterial adhesion and invasion and cause the endothelial injury. So when the endothelial is injured, it will lead to the coagulation activation and result in the fibrin and platelet accumulation. So from here, it will lead to the vegetation formation, which is the attachment of the inflammatory cell, bacteria, and platelet, also the fibrin. This vegetation can lead to the valve destruction, and also it can detach and cause the septic embolism. This embolism will travel in the blood circulation and cause sepsis, which can result in the fever, hypotension, and septic shock. So next, the pathophysiology of subacute infective endocarditis. So it starts with the previous damage of the heart valve, like ventricular septal defect or others congenital defects. So it will cause the endothelial damage. So from the endothelial damage or injury, it will lead to the coagulation activation, but the sterile types, which is not involve any bacteria, not involve any bacterial. So when the bacteria enter the bloodstream through the several route of infection, like through the IV catheter sharing or using the infected IV catheter sharing, the bacteria will travel in the blood circulation and goes to the heart, specifically at the endocardium or heart valve. So this will cause the bacterial adhesion and invasion and leads to the vegetation formation, but slow progressive vegetation. So from the vegetation, it will cause chronic inflammation, and in a long term, it will lead to the formation of antigen antibody complex. And this antigen antibody complex can travel throughout the body through the blood circulation and deposit in the other organs such as kidney, lungs, and others. So, from the vegetation formation and the chronic inflammation, it can cause valve damage and leads to the valve regurgitation.
Hi. So today I will explain the clinical manifestation and investigations of acute and subacute infective endocarditis. So first, for acute infective endocarditis has a sudden and aggressive onset. So patient usually present with high fever, chills, severe toxicity, tachycardia, and shortness of breath. This happens because highly virulent bacteria such as Staphylococcus aureus, which rapidly destroy the heart valves. The damaged valves can lead to acute heart failure, which cause dyspnea and pulmonary edema. Septic emboli are also more common in acute infective endocarditis, which may cause stroke, skin lesions, or organ infarctions. In contrast, subacute infective endocarditis develops more slowly and is usually caused by less virulent organisms such as Streptococcus viridans. Patients commonly present with low-grade fever, fatigue, weight loss, weakness, night sweats, and a gradual developed heart murmur. So, immune-mediated manifestations such as oscillate nodes, Roth spots, and hematuria are more commonly seen in subacute cases because the infection persists for a longer durations. Now, I will explain the investigations and relate them to the clinical manifestations. First is blood culture. Blood culture is the most important investigation because it can show the bacteria causing the infection, such as we have Staphylococcus aureus in acute cases or Streptococcus viridans in subacute cases. So this relates to fever, chills, and night sweats because the bacteria are circulating in the blood. Second is echocardiography, either TTE or TEE. Echo can show vegetations, valve destruction, abscess, or regurgitations. These findings explains the heart murmur, shortness of breath, and heart failure symptoms because the infected valve cannot function properly. Next is the full blood count, ESR and CRP. Full blood count may show increased white blood cells because of the infections and low hemoglobin because of the anemia. ESR and CRP are also increased because of inflammations. This relates to fatigue, weakness, fever, and prolonged illness, especially in subacute infective endocarditis. Then we have ECG and chest X-ray are also done where ECG may show arrhythmia or heart block if the infection affects the heart conduction system. Chest X-ray may show cardiomegaly or pulmonary edema, which explains shortness of breath and signs of heart failure. Lastly, urinalysis and CT or MRI scan, which helps to detect complications. Urinalysis may show hematuria or proteinuria due to kidney involvement. For CT or MRI may show stroke, brain abscess or organ infarction which caused by septic embolism. This relates to symptoms such as blood in urine, neurological symptoms or sudden organ pain. So in conclusions, Infective endocarditis is a serious infection of the heart valve that can present as acute or subacute disease. Early recognitions of these clinical manifestation and appropriate investigations are important to confirm the diagnosis, identify complications, and provide fast treatment to prevent severe valve damage and systemic embolic complications.
Okay, to wrap things up, we have seen how rheumatic heart disease and infective endocarditis can seriously affect the heart in different but equally dangerous ways. RHD often begins after an untreated throat infection and can quietly damage the heart valves over time, while endocarditis is more of an acute invasion where bacteria directly infects the heart lining and valves. Even though their cause differs, both reminds us of one key message. Preventions, early detections, and timely treatment are crucial to protect the heart. So let's take this condition seriously, because a healthy heart truly means a healthier life. Thank you and have a good day. That is all from us. We hope you enjoyed our presentation.